I'm Joe Chili. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck Presents Buffalo on the Rise is Dr. Colin Anderson from Fichte, Endl and Elmer Eye Associates. Welcome today.
Thank you, Joe. Good to be here.
Glad to have you here. You know, when do people, when we start talking about their eyesight, is it a misnomer to think that people, when they hit 40 years of age, boom, that's it. That's when your eyesight changes?
It's a continuous process. In 40 years of age is when it might be noticeable, but it actually starts at birth. A lot of the changes inside the eye where you start to need reading glasses when you're 40, it has been creeping up and creeping up and creeping up for years and years and years, and then finally you notice it in your vision around 40.
You know, my grandmother used to make me feel so good because she says, you know what happens is you're born and then every day after that you kind of die a little bit. And that's exactly what it seems like when you're talking about glasses. When you're talking about the eye ages right from the point of birth, huh? Well, that's pretty amazing. So when do most people see a change in their eyesight?
So the reading glasses start in the 40s, and then an ophthalmologist or an optometrist who looks at your eyes with a microscope may be able to look in and say, well, you have the start of cataracts around that age, and say the lens on the inside of the eye, if you picture a camera lens, is starting to become a little bit cloudy. But that's not apparent to you looking out through your eyes until later. You know, we can see it with a microscope first, and then eventually it will start to affect the vision. Things become cloudier and cloudier. Glare at nighttime is a very typical early symptom. People have trouble driving with headlights coming at them, having difficulty seeing the lines on the road when it's raining at nighttime especially, and then eventually losing the fine print, even with good glasses on, and having to turn on more and more lights around the house as the cataract gets more and more mature. And that may be in the 60s or 70s or even the 50s sometimes when people start to notice those symptoms.
Are people resistant to getting cataracts because, or cataract surgery, I should say, because they feel, oh no, I don't need it. I'm not getting older. I mean, I don't need glasses. I don't need this. I don't need that. Do you get resistance?
A little bit. But then people, I think, are very quick to understand when we have the conversation that this is not the same cataract surgery as your grandparents and your parents had. This technology has come a long way. Cataract surgery is much safer, much more reliable, much more repeatable than it was even 20 or 30 years ago. So because of that, when we look at a risk-benefit balance as a surgeon, it happens much earlier that it's in the patient's favor. So the benefit is there, and the risk is so much smaller than it was 20 or 30 years ago that you don't have to lose good years of your vision waiting and waiting and waiting for that equation to tip in your favor. That happens in the 50s and 60s now. And once people understand that, they're excited about it.
All right, so to kind of back up from cataracts for a second, are there any specific or general eye problems that you wish people would have come to you sooner with?
The big one is glaucoma. When you see a late presentation, when somebody comes in late in the course of glaucoma, you really wish you had met them earlier, because that is a very slowly progressive process with no symptoms early on, but any changes that do happen because of glaucoma are typically irreversible. So your treatment options as a doctor are designed to slow down or halt the progression of the disease, but there's nothing to reverse the progression of the disease. Cataracts, we're very fortunate because we can get that cataract, that cloudy lens out of there, and we can get a clear lens implant in, and that's entirely reversible. So it's a little bit of a different picture.
What about your traditional eye exam? How often should people generally, if they don't have a problem like, you know, diabetes or something like this, when should they really go in for eye exams? I mean, and it's something that people tend to overlook.
I think every year, especially over the age of 40, and that's really what the big societies of ophthalmologists and optometrists agree upon. Getting the back of the eye checked with dilating drops, that's a part of the body that only an ophthalmologist can look at, only an optometrist can look at, one of those two professions. It's not like your skin, you know, where you look at and you say, well, I have this mole here and that hasn't been changing for 15, 20 years, so I'm not worried about it. If you have something like that going on in the back of the eye, there's only one person who can look at it, so you got to come in every year. And it's, you know, early diagnosis of glaucoma, monitoring anything that is picked up there. It's hopefully quick in and out where you say, nope, everything looks good, I'll see you again in 1 year. But every once in a while we find something very important, and we're glad that somebody took the time to come in.
And the method, or what the procedure. If somebody comes in and you examine them and they have the beginnings of cataracts, how long before they actually have to have surgery generally?
Well, surgery is designed to fix a problem. And cataracts aren't a problem until they're affecting somebody's vision. So if somebody is unhappy with the way that they're seeing, and based on the eye exam, it's due to the cataract, with the modern technology that we have, I mean, that's where it's reasonable to start talking about surgery and consider doing surgery.
What about lunch and learns? What are people going to find out? We hear about your lunch and learns all the time. What do they find out at their lunch and learns?
So Lunch and Learn is a free lunch paid for by the practice where one of the surgeons, either myself, Dr. Endl, or Dr. Elmer, will come in and we'll go over a presentation about cataract surgery. We'll talk about what a cataract is, some basic anatomy of the eye and why we have to do cataract surgery, and talk briefly about lens implant options at the time of cataract surgery. And having that information kind of under your belt before you come into the practice for a consultation is very helpful, because then we can spend time talking about the things that are specific to you. And instead of spending a lot of time on the general information, where you have about 15 to 20 minutes to get through everything, you can spend that 15 or 20 minutes saying, but here's your specific situation, and here are the specific options for you that make a lot of sense.
And people shouldn't be worried about, does it hurt?
It does not hurt. Do not be worried about that. So we have plenty of medications to keep you comfortable. And after the surgery, the most that most people feel is a little bit like an eyelash stuck under the eyelid or a couple grains of sand in the corner of the eye. Very mild discomfort that improves quickly.
Very good. All right, thank you very much, Dr. Colin Anderson. For more information and answers to your questions, contact Fichte, Endl and Elmer Eyecare by calling 1-800-309-2020 or go to fichte.com. Sponsorship and promotional considerations for the preceding segment provided by the following.